Let's listen to an expert doctor for hypertension in young population, along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Sarthak Saho, MBBS PGDCC, Rajmahal Villas Hospital, Bangalore. Can high blood pressure be completely cured?
Cure is almost next to impossible for high blood pressure, because high blood pressure is an end result of multiple factors, some of which are not reversible at all. But yes, high blood pressure in most cases, most instances, it can be managed or it can be controlled.
What is the prevalence of heart rate in hypertension?
So heart rate is also one of the parameters which needs to be controlled along with the high blood pressure. The problem with the high heart rate is that when it is very high, it can weaken the heart over a period of time. And a problem with a very low heart rate is that it will not be sufficient enough to sustain the body or to sustain the functions of the body. So heart rate has to be kept within a certain parameter. The ideal heart rate maintained should be somewhere between 50 to 70 or let's say 80 beats per minute. And if the heart rate is more than that, then we start adding some drugs to lower the heart rate along with the BP reducing drugs. And if the heart rate is low, then we need to see further what is the reason, and accordingly sometimes put in a pacemaker, sometimes treat the thyroid problem, sometimes some other issues we have to tackle.
What precautions should a patient take along with medications?
This is the most important thing that needs to be understood by patients. Medications are prescribed by doctors and the patient just takes them blindly. But along with that, there is something which a patient can do to control their high blood pressure condition. The most important being is to get adequate sleep in the night. At the same time, have sufficient exercise in the daytime. Number 3, being particular about the diet, which is to limit the intake of salt, to reduce almost take as less deep fried food as possible. The most important in food is to avoid taking deep fried food, and along with that they need to have good regular timings for sleep, for activity, and not just continuously be under the stress of work or so. That is something which is very, very important for this. That is something which a patient can do along with the taking of medicine in order to control their blood pressure.
Thank you, doctor, for your time.